The Mediterranean diet is a healthy eating pattern and is characterized by generous amounts of fruits and vegetables, whole grains, legumes, fish, seafood, and nuts. Few dairy products and little meat and meat products are consumed. The diet is rich in extra virgin olive oil, and it also includes moderate alcohol intake in the form of wine with meals. A 2015 study found the strict adherence to a Mediterranean diet reduces the severity of psoriasis. Notably higher consumption of extra virgin olive oil and fish were independently associated with lower psoriasis severity. Compared with the general population, patients with psoriasis and psoriatic arthritis have a greater frequency of concurrent autoimmune diseases, including celiac disease. A 2014 review concluded that a gluten-free diet might benefit the psoriasis patients who have elevated celiac disease antibodies. In some cases, a complete clearance of psoriatic skin was reported following the gluten-free diet. A rigorous review and analysis of medical literature determined that weight loss by means of diet and lifestyle interventions reduces the severity of psoriasis in overweight or obese patients. Environmental therapy comprises of the utilization of environmental factors like sunlight, salt, mineral baths, unique properties of certain geographic regions and climates, to modify the course of the disease. These therapies have been used for thousands of years, and they've been included by the ancient Greeks and Romans. Chemotherapy and balneotherapy are overlapping treatment strategies shown to be beneficial for psoriasis. Climatotherapy is based on the healing capacity of environmental factors associated with certain climatic locations, including air, temperature, humidity, barometric pressure, and light. Climatotherapy at the Dead Sea in particular is an effective natural treatment for psoriasis. The low altitude of the Dead Sea, the lowest human inhabited place on Earth, at 419 meters below sea level, results in lower intensity ultraviolet radiation, reducing the risks associated with greater exposure duration. Also, the unique spectrum of radiation in this region might be particularly beneficial for skin disease. Bathing in the Dead Sea, which is the saltiest sea in the world and has an extremely high mineral concentration, may normalize the skin cell proliferation rate. Studies of psoriasis patients undergoing Dead Sea climatotherapy have reported impressive results: high response rate, long periods of remission, and partial to complete plaque clearance. In one study, Dead Sea climatotherapy improved plaque psoriasis disease by 95% in up to 3/4 of the subjects. Patients with early onset psoriasis responded better than late onset patients. In another study, Dead Sea therapy resulted in significant improvements in the quality of life of the patients with psoriasis and psoriatic arthritis. Balneotherapy is the medical use of mineral water and mud baths. In a randomized clinical trial, the synchronous balneotherapy, artificial balneotherapy that stimulates conditions at the Dead Sea, was superior to UVB phototherapy after 35 treatment sessions and 6 months of follow-up. Two studies, which included a total of 30 patients with moderate to severe psoriasis, demonstrated that exposure to sunlight resulted in substantial clinical improvement. All patients stopped taking their psoriasis medication 4 weeks before beginning the heliotherapy. The treatment began with 45 minutes of sun exposure on both the front and the back of the body, with a gradual increase in exposure over the following days. The trial lasted for 16 days. No sunburn occurred in the study. A dramatic reduction of inflammatory cell numbers preceded the skin improvements, suggesting the sunlight might act through the immune system modulation. It's important that sun exposure be limited to a duration that doesn't result in sunburn. The American Academy of Dermatology has called for the use of unmedicated topical moisturizers, an internationally accepted standard adjuvant treatment approach in the treatment of psoriasis. In control trials of corticosteroid topical treatments, in which a placebo is essentially an unmedicated moisturizer. Placebo response rates of up to 47% have been found, suggesting moisturizers alone have a beneficial effect for psoriasis. Various preparations can be used as moisturizers or emollients, including creams, ointments, and oils. Patients should incorporate topical moisturizers into their routine, with the application twice a day and after bathing. Using fragrance-free products and washing with moisturizing soap is also recommended. Moisturizers promote skin rehydration by reducing the water loss through evaporation. Chronic sleep deprivation impairs the skin's integrity. It weakens its function as a protective barrier, and it exacerbates the inflammation of psoriasis. Melatonin is a hormone produced mainly by the brain's pineal gland, and it may play a role in the increased risk of psoriasis that's associated with sleep disruption. Secreted only during darkness, melatonin regulates the circadian sleep-wake cycle, promotes sleep, and it modulates inflammation and immune function. Studies have shown that nighttime melatonin levels are significantly lower in psoriasis patients when compared to controls. Some research proposes that sleep loss and circadian rhythm disruption should be considered as risk factors for the development of psoriasis. Emotional stress is often a consequence of dealing with psoriasis, but increasing evidence suggests stress also contributes to the development and the exacerbation of psoriasis. Stressful life events have been reported to precede the onset of psoriasis in 44% of the patients and trigger flare-ups in 88% of psoriasis patients. Research suggests the body's stress response might be improved in psoriasis. Therefore, managing the stress is an important goal for psoriasis patients. A thorough review and analysis of the medical literature found fish oil supplements are beneficial for psoriasis. Fish oil supplements given to the psoriasis patients for up to 6 months resulted in clinical improvements in skin redness, hardening, and scaling, and some studies found a benefit for the itching. Fish oil might also be effective as a complement to other therapies. In one study in patients with plaque psoriasis, the combination of omega-3 fatty acids and a topical form of vitamin D resulted in significantly greater improvements than the vitamin D alone. Fish oil is well known for its potent anti-inflammatory properties. Elevated concentrations of the pro-inflammatory omega-6 fatty acid, arachidonic acid, and inflammatory compounds lutrein B4, which is derived from arachidonic acid, have been found in the skin and the red blood cell membranes of psoriasis patients. By displacing the arachidonic acid in the cell membranes, the omega-3 fatty acids EPA and DHA suppress the inflammation by inhibiting the production of pro-inflammatory compounds such as lutrein B4. While topical synthetic forms of vitamin D are used in the conventional treatment of psoriasis, multiple studies have demonstrated the natural form of vitamin D3, which can be taken orally, might be a safe, effective psoriasis treatment. Oral vitamin D has the important advantage of improving the vitamin D status, and this results in many health benefits. A number of studies have shown that psoriasis is associated with low serum levels of 25-hydroxyvitamin D. Vitamin D acts as an immune modulating hormone, and it can reduce the rapid growth of skin cells, and it can suppress inflammation. Higher levels of vitamin D are associated with lower risks of cardiovascular disease, diabetes, and metabolic syndrome. All are associated with psoriasis. In a 2013 study, psoriasis symptoms significantly improved in the patients who were receiving high daily doses of vitamin D3 for 6 months in combination with a low calcium diet and aggressive hydration. Blood chemistry parameters remained within the normal range, and authors explained that restrictions of dietary calcium likely played a key role in avoiding the excess calcium levels in the trial of the high-dose vitamin D. Nevertheless, 35,000 international units that was used is much higher than the usual daily dose of vitamin D, and anyone on high-dose vitamin D should test their blood for 25-hydroxyvitamin D regularly and then adjust their dose as necessary to avoid excessive levels. The high-dose vitamin D used in the study might have compensated for the genetic variations or polymorphisms that are related to the vitamin D metabolism that are common in autoimmune conditions like psoriasis. These inherited polymorphisms induce a relative resistance to vitamin D, necessitating higher doses to achieve the optimal biological effects. Indeed, experimental research has shown the genetic variation in the activity of 1-alpha-hydroxylase, the enzyme that converts 25-hydroxyvitamin D to 1,25-D-hydroxyvitamin D, the active form, strongly influences the serum levels of the active vitamin D. In fact, specific 1-alpha-hydroxylase mutations can cause vitamin D-specific rickets. In mice who are prone to autoimmunity, the upregulation of 1-alpha-hydroxylase activity in response to immune stimuli is dysfunctional. It's been proposed that 1-alpha-hydroxylase activity upregulation in the immune cells during inflammatory stimuli serves as a guard against autoimmunity. Thus, one factor contributing to autoimmune disease could be defective 1-alpha-hydroxylase activity. Taking high doses of vitamin D may then help to overcome this defect by providing abundant substrate upon which the suboptimally functioning 1-alpha-hydroxylase can then act. Pycnogenol is an extract from pine bark of the French maritime pine tree. It contains a range of polyphenolic compounds, including proanthocyanidins, bioflavonoids, and catechins. The pycnogenol has strong anti-inflammatory, anti-clotting, and vasodilating properties. In a placebo-controlled clinical trial in psoriasis patients, the addition of 50 mg of pycnogenol 3 times per day to a standard treatment resulted in a significant improvement in the skin redness, hardening, and the scaling compared to the standard treatment alone. Studies have also demonstrated that pycnogenol has beneficial effects in metabolic syndrome, which occurs frequently in patients with psoriasis. Polypodium is a tropical fern and is native to Central and South America, where it has a long history of use as a herbal medicine for the treatment of inflammatory skin diseases. The polypodium extract can help to protect the skin from the harmful effects of ultraviolet radiation, and it can decrease the phototoxicity, pigmentation, and the damage of the human skin induced by PUVA treatment. Because it also decreases DNA damage and immune suppression induced by UV radiation, the polypodium can slow premature skin aging, and it can reduce the risk of skin cancer. While phototherapy, particularly PUVA, is a very effective treatment for psoriasis, it carries the risk of skin cancers, including melanoma. The photoprotective effect of the polypodium makes it a potential adjuvant to the phototherapy used for psoriasis. Peony glucosides are extracted from the root of the peony plant, and they've been shown to help to restore immune system balance by decreasing the production of inflammatory cytokines. The peony plant has also been used in traditional Asian medicine to treat autoimmune disease. Findings from a 2014 study demonstrate potential benefits of the peony glycosides for the treatment of psoriatic arthritis. Substantial clinical improvements along with a significant drop in inflammatory cytokines were observed in 32% of the patients who were treated exclusively with the peony glycosides. These results merit further investigation of the peony as a safe and effective treatment for psoriatic arthritis. The spice turmeric has been used as a herbal remedy in traditional Chinese and Ayurvedic medicine for thousands of years. The curcumin is generally considered to be the most active constituent in turmeric, owing to its anti-inflammatory properties as well as its ability to inhibit excessive new growth of cells and blood vessels. The curcumin has promise as a potential therapy for the treatment of psoriasis. In a clinical study, a combination of oral curcumin and topical steroids was superior to topical steroids plus a placebo in treating the psoriasis. These results suggest that curcumin can be a safe and effective adjuvant therapy for psoriasis patients treated with topical steroids. The trillions of bacteria that are present in and on the human body are called the microbiota, and they have a pronounced effect on our immune system. They have a direct effect in the digestive tract, and they act systemically also, affecting distant sites including the skin and the joints. An altered microbiota is a factor in the initiation and the promotion of immune-mediated inflammatory diseases, including inflammatory bowel disease. Both psoriasis and psoriatic arthritis have been associated with inflammatory bowel disease, and it's been suggested that the microbiota might play a key regulatory role in the inflammatory pathways shared by these diseases. In fact, emerging evidence suggests the psoriasis might not strictly involve autoimmunity, but it could be the consequence of the interaction between the innate immune system and some bacteria of the human microbiota. In a 2013 study, the administration of a probiotic called Bifidobacterium infantis significantly reduced the plasma level of the inflammatory biomarker C-reactive protein and tumor necrosis factor alpha in psoriasis patients. Psoriasis is marked by an increase in oxidative stress and a decrease in the levels of glutathione, the body's major scavenger of reactive free radicals. Whey protein effectively increases the cellular glutathione levels because it's a rich source of the amino acid precursors of glutathione, particularly cysteine and related compounds. In one study, the administration of whey protein isolate over 3 months resulted in clinical improvements in patients with psoriasis, regardless of whether the whey protein was given alone or in addition to topical or light therapies. Resveratrol is a polyphenol and is found primarily in grapes, red wine, Japanese knotweed, and some berries. It effectively modulates inflammation, cell proliferation, and new blood vessel formation. Resveratrol significantly improves the severity of skin inflammation in a mouse model of psoriasis. Skin thickness, redness, and scaling were all reduced in the resveratrol treated group when compared to the control group. Resveratrol decreased the production of the inflammatory cytokine interleukin-17 and interleukin-23, both significant contributing factors in the formation of psoriatic plaque. The essential mineral zinc plays an important role in maintaining a healthy immune response. Zinc modulates the production of inflammatory cytokines like interleukin-2 and interleukin-6. In a study in mice with induced psoriasis, injections of zinc into the abdominal cavity mitigated oxidative stress, and it caused a significant decrease in the elevated serum levels of inflammatory interleukin-2. According to one case report, supplementation with 50 mg of zinc twice per day in a 67-year-old female with pustular psoriasis completely cleared the skin lesions in 2 weeks. Zinc's anti-inflammatory and immune-modulating effects might explain its therapeutic efficacy in this case. However, 100 mg of supplemental zinc daily is a relatively high dose and might not be suitable for everyone. Selenium is a cofactor for enzymes like glutathione peroxidase and vitamin E, and they're important contributors to the body's defense against oxidative stress. Concentrations of both vitamin E and selenium have been reported to be lower in psoriatic patients than in healthy subjects. Oral or topical administration of vitamin E and selenium might be beneficial for the treatment and the prevention of psoriasis. In a double-blind, placebo-controlled clinical trial in patients with erythrodermic psoriasis, a severe form of psoriasis that usually affects much of the body's surface and causes marked inflammation and skin turnover, and psoriatic arthritis, the supplementation with selenium and vitamin E together with coenzyme Q10 resulted in significant clinical improvements in disease severity. Selenium supplementation and vitamin E was demonstrated to increase the low levels of glutathione peroxidase in 50 patients with various skin disorders, including psoriasis. In another study, a measure of glutathione activity in psoriasis patients, who were drinking selenium-enriched water was found to be 50% higher than those who were consuming a low selenium water. Many vitamin E formulas consist only of alpha tocopherol, but mounting evidence suggests that other members of the vitamin E family, especially gamma tocopherol, might be particularly integral to vitamin E's beneficial effects. Levels of homocysteine, an independent risk factor for cardiovascular disease and possibly Alzheimer's disease, are often elevated in patients with psoriasis. Some studies have reported that psoriasis patients have lower levels of B vitamin folate, which is essential for the breakdown of homocysteine. In one case control study in patients with chronic plaque psoriasis, high plasma homocysteine correlated with increased disease severity and low levels of folate. Another study found decreased blood folate levels and increased plasma homocysteine levels in psoriasis patients who underwent UVB phototherapy. Melatonin is a neurohormone and is secreted by the pineal gland in the brain. It regulates the 24-hour circadian rhythm, the sleep and the inflammatory and immune response. As an oral supplement, the melatonin has been shown to be helpful in various sleep disorders such as insomnia and jet lag. Nighttime levels of melatonin have been demonstrated to be significantly lower in psoriasis patients than in the matched control subjects without psoriasis. Shift workers with disrupted sleep-wake patterns also have low nighttime melatonin levels, along with an increased risk of psoriasis. Given its complex and critical role for regulating a wide range of physiological functions, melatonin is being actively investigated for its importance to the majority of inflammatory diseases associated with psoriasis, including cardiovascular disease, type 2 diabetes, metabolic syndrome, and cancer. Capsaicin is a pungent compound and is present in various hot peppers, including red chili peppers, jalapenos, and habaneros. Topical creams containing capsaicin have a long history of use as a pain-relieving agent. In a double-blind study in which capsaicin cream was applied to only one side of the body of psoriasis patients, a significant reduction in scaling and redness was observed on the side with the capsaicin application. While nearly half of the patients reported burning, stinging, itching, and redness upon the initial application, these symptoms diminished or disappeared with the continued treatment. The ability of the capsaicin to inhibit the dilation of the blood vessels in the skin might have played the role in the therapeutic benefit. In another study in patients with pruritic, itchy psoriasis, the topically applied capsaicin was shown to significantly reduce the itching and the overall disease severity. Commonly known as frankincense, Boswellia serratigum extract has been used in traditional Ayurvedic medicine, and is now being investigated and used for the treatment of chronic inflammatory diseases like rheumatoid arthritis and inflammatory bowel disease. Boswellic acids, the active component of the Boswellia serrata resin, exert anti-inflammatory effects primarily through the inhibition of pro-inflammatory enzyme 5-lipoxygenase. Topical Boswellia extracts might be promising for the treatment of psoriasis. In a double-blind, placebo-controlled study, a topical formulation based on boswellic acids was shown to be effective in the treatment of psoriasis. Specifically, the boswellic acid formulation improved scaling in 70% of the subjects and skin reddening in 60% of the subjects. None of the participants experienced an exacerbation of their condition. Previously, in a mouse model of psoriasis, a boswellic acid that was injected systemically under the skin inhibited NF-kappa B, a signaling molecule that's implicated in exacerbating psoriasis. This resulted in markedly decreased production of inflammatory cytokines like TNF-alpha, along with a profound improvement in the psoriasis-like skin inflammation. For more on herbs, supplements, and natural treatment plans, check out my website.